Many times I begin my talks with trying to show people just how important it is for people to see how things are connected, to see that when you're talking about health, let's say you have a cardiac condition, a heart condition. When you're talking about a heart condition, the solution to that problem is not just a heart medication. There are so many other things that are involved in what goes on in the heart and what affects your physical heart, and that includes your spiritual life, your mental life, your social life, your financial life, your physical environment. So many things come together to affect your cardiovascular system. And what we want to do, as always, is to help to make all those different factors, bring those different factors to your understanding and make it simple enough so you know instinctively what to do in certain circumstances, and you know how to keep all those bases covered. But then again, when we talk about spirit, soul, and body, we also, within the body aspect, we also have to focus on the different things, like Sherry said, that connect with different parts of our body, and the mouth, for instance. And I'm not going to say too much about this because Dr. Luna is going to explain this, but the mouth, what happens in your teeth and your mouth, surprisingly enough, affects several parts of your body. And so that's why I am so happy again to have Dr. Luna, a man of his caliber, come speak to us about the connection between what happens in your mouth, what happens in your body. And Sherry, I'm just going to ask you to take it away with the bio.
Okay. Dr. Luna is a 1994 graduate of the University of Alabama School of Dentistry. After graduation, he completed a 2-year residency at the Medical University of South Carolina before returning back to Birmingham, where he has served the public's needs since 1997. Dr. Luna has received multiple awards and recognitions during his 12-year career, including being recognized as one of America's top dentists every year since 2003.
Wow.
Recognized as one of the leading health professionals in the world in 2005. He was also voted Best of Birmingham in 2008 and 2009, and he's one of the youngest dentists to ever receive a fellowship award in the Academy of General Dentistry. Dr. Luna presents multiple lectures throughout the year to the public, to dentists, and to physicians on topics ranging from cosmetic dentistry, TMJ, about mercury filling, treatments for snoring, and sleep apnea even. Known for his cosmetic dentistry, Dr. Luna's work has been highlighted in dental laboratory magazines and continuing education courses throughout the country. Dr. Luna is an avid outdoorsman and enjoys almost every activity that you can do outdoors, including hiking, camping, boating, fishing, mountain climbing, and triathlons. His favorite thing to do is travel, and he spends as much time as possible that he can with his 2 daughters. So, Dr. Luna, are you there?
I am here.
Okay.
Can you hear me fine?
Yes, we can. We can. And again, thank you for taking the time to prepare for this and to grace us with your information. But I just want to have a quick question, though. I mean, how did you manage to accomplish all this? I mean, you don't look any older than 18.
Oh, the picture's 10 years old now, so.
Is it really?
No.
Oh, good job.
I think once I got out of school, I kind of got real serious about it and realized that this is the rest of my life, and started noticing there's actually one doctor in residency in particular that opened my eyes to the effects the mouth can have everywhere else, and it was this specific doctor in Charleston that really made me start going on and thinking outside the box and seeing what else we can accomplish.
Wow. Well, you have the floor, and we are listening intently.
Okay. Well, I'm nervous because you built this up so big. You guys So hopefully I can entertain and keep everybody interested here. And I want to thank you for this opportunity and the chance to talk about some of the topics in dentistry that I feel very passionate about. And there's really three things we're going to talk about tonight, and the possible serious effects that these areas have on the rest of the body. And I hope at the end of this will open your mind to think outside the box and for possible treatment modalities that no one would usually consider. We'll keep going from there. One of the first things that always pops up, is kind of a joke around my office, is the saying, "But you're just a dentist." People always ask, "Well, I've got this problem here, but I realize you're just a dentist." So, they want my advice, but they're telling me I may not know the answer. And that's okay. We understand that. And I've always wondered what's happened. You look at every part of the body, and you have a physician specialist for everything from your feet all the way up to your hair. But for whatever reason, we have disassociated the mouth from the rest of the body. And I think you're starting to, as you mentioned earlier, your physician that treats cancer, people are looking at things different now and realizing, okay, for whatever reason we've done this, this is kind of the gateway to the rest of the body as we're going to talk about, and hopefully things will continue to change that way.
Mm-hmm.
But as I look into the past and wonder why it's happened, all I can come up with is the fact that hundreds of years ago, if you had a problem or you needed a tooth pulled, you could go to the barber. You could get it done. And so that's why I have that picture in there for that reason. And sometimes it's little things like that that dictate the way things are done in the future, just like brushing your teeth twice a day. That was a commercial that came out, I don't remember now, 60 years ago. And it was a toothpaste that says, see your dentist twice a year. And from that reason on, insurance dictated that's how often patients should come to see a dentist, twice a year. So it's always amazing how something so little can dictate the future of a profession.
Wow.
Anyway, there are the three things we want to really talk about today, okay, and affecting the body. It's going to be first periodontal disease. I'm not going to spend a whole lot of time on this unless people have a lot of questions on it. We're also going to talk about TMJ, and then I'm going to finish with amalgam or silver fillings, and these are also called mercury fillings. I've always found that this is where most people want to ask the most questions, and so I've saved this for last so we'll have more time to answer anybody's questions. So let's start off with periodontal disease first. What is it? It is the leading cause of tooth loss in adults. The scary part about periodontal disease is that 70 to 80% of all adults have some form of it. There's different degrees of severity. Basically, it's a bacterial infection that is eating away everything in its path. So this bacteria is eating the tooth, it's eating the gums, it is eating the bone that holds the tooth in the jaw. So what are some of the signs of gum disease? Red or swollen gums. Bleeding gums. So if you brush your teeth or you floss and you see some bleeding, that's not normal. If your tooth is loose, obviously you got some issues. Bad breath. And sometimes pain. Usually it's painless until it gets to a very, very severe state where your hopes of saving a tooth are pretty much none. And so the problem with periodontal disease and why it is so significant is because it tends to have no pain. So sorry for the picture.
Yeah.
But I hope everybody can see my arrow here.
Mm-hmm.
This is basically what happens periodontal disease. It's every day we build plaque on our teeth. This is what we're supposed to brush off. If we don't brush all of it off, we end up, the plaque mineralizes and it becomes tartar or calculus. That's a hard substance that we can see right here on these root surfaces. This is just nothing but bacteria, as I said earlier, that's eating away everything in its path. So if you look across here, this is where the root surface and the tooth itself meet. This is where the gums and the bone used to be on this patient. And all this bacteria is eating away all the gums and bone from there down to there. Okay, as we can see, we've already lost teeth. We have mobility. You can kind of tell this tooth's been pushed out and moved around. So this is obvious for anybody to see.
Are those teeth Are those teeth joined together, the lower incisors? Are they actually joined?
These are here because these teeth are very loose, and this unfortunately is a patient that probably did not want to go on with further treatment recommendations, just doing everything they can to save them. So when this patient came to me, they were splinted together like this, and it was just the hopes of holding them so they wouldn't fall out individually.
Okay.
When they lost their teeth here in the back, all their pressure is now being put on these front teeth, and they're not meant to receive that force.